Good morning. My name is Dr. Raphael Akombe. I am an health information management consultant. I'm a lecturer in Lagos State College of Health Technology and also in other higher institutions. I want to talk about a particular topic as part of the topics I have in one of my books that I wrote, titled Health Informatics, Interdisciplinary Approach in Healthcare Management. The topic I would like to talk this morning is factors affecting the use of health informatics. We all know that health informatics is the engine in healthcare delivery system. It facilitates effective delivery of services to patients and ensures accurate documentation of patient information. Now back to our topic, factors affecting the use of health informatics. Optimizing information management requires a focus first on value. Successful organizations understand that their strategy set by their business plan is the driver. Informatics is the enabler, and information technology provides the tools. As Paul Strassman remarked in his book, titled The Squandered Computer. He said the principal purpose of investing in IT is not overhead cost reduction, but value creation. Cutting costs can contribute to profitability, but in the long run, one does not prosper through the shrinkage. And the objective of all investments is to improve overall organizational performance. To improve performance, IT and health professionals need to work as a team. Both need to understand the problem being addressed. Both need to contribute their expertise towards its solution. Increasingly, trained health informaticians are playing a critical role in developing, selecting, and implementing applications. These roles include helping health professionals understand what informatics can offer in order to make wise decisions about information technology. We do not dispute there is waste, but we question whether it is the result of inefficient computer systems. It is more likely, we believe, that ineffective use of those computer systems is the cause. One striking example comes in the aftermath of the year 2000. To avert problems associated with older systems, many institutions install new applications without leveraging them to add value to their core business. Recent studies show this to be a common failing in healthcare and in industry in general. Institutions need to make concerted efforts to target objectives and processes as they acquire and integrate IT. Those with newly installed and incompletely leveraged systems should revisit such critical activities and establish a clear agenda for the change. This need to establish and measure value, which is manifested in another area. Specifically, that area involving work processing. We mentioned the importance of human factor earlier and the need for both organizational skill and technique. In the broadest sense, human factors extend to include organizational and professional development, both of which imply redesign work processes. Such efforts must be ongoing if staff are to learn new skills, use new tools, and make optimal use of new technology. Unlearning old ways is critical and even more difficult than learning the new. New ways of doing work are the end point of the classic three-stage model for technology adoption. First, substitution. Second, innovation. And third, transformation. Medical imaging provides an excellent example of this model. The old radiology department disappeared gradually and are gone forever, and new tools support diagnosis and intervention previously impossible. Changes in informatics of the sort we discuss here will proceed in the same fashion. After being used in specific places for special uses, new technologies will become more widespread, and the changes they enable will become more commonplace. There is also a need for us to know how internet is affecting the provision of health services. The internet can help control costs. More importantly, it can change information flow in health-related areas in industry, such as banking. The internet has cut costs and transformed the way business is carried out. Healthcare organizations choosing the internet for simple business processes also stand to realize major cost reductions. It is estimated at 10:1 to 100:1 in routine transactions, both businesses to business and business to consumer. However, in John Naive's book, which states, the new source of power is not money in the hands of a few, but information in the hands of many. In healthcare delivery system, where information can literally be a lifesaver, the power of the internet lies in its unprecedented capability to make information available when, where, and how it is needed. It is quite very obvious that health informatics is a vital tool in healthcare delivery systems. I'm going to stop here. In my next lecture, I'm going to talk on another topic which is going to interest you. But before I stop, I want to urge the government, the organization, and every individual to ensure that they embrace this lucrative discipline called health informatics, because it facilitates effective delivery of healthcare service. Thank you very much and have a blessed day.